I'm now going to talk about Chapter 6. Hopefully you've looked at the presentation on Chapter 5 that gives you a little bit more general information about how I approach the study guide. In Chapter 5, all of the terms were fine. You could find them with the book. In this case, I start out with Chapter 6, and I'm looking at diseases and conditions, and I'm looking at the category of blood. The first word is dyscrasia. Dys means painful, difficult, or abnormal, and crasia means a mixing. Right away, I'm a little bit confused because I don't see a combining form with this word. I just see a suffix and a prefix. And the definition isn't hard to understand. It means any disease or condition involving blood. But I am a little bit curious about how this word breaks down. So I did refer to Dorland's, and I found that it says a term formerly used to indicate an abnormal mixture of the four humors. In surviving usages is now roughly synonymous with disease or pathological condition, and it says a pathological condition of the blood, usually referring to disorders of the cellular elements of the blood. So I think I'm going to look online, which I did, and I found that dyscrasia is generally used as any disease or condition involving blood cells. So I'm going to accept that and move on. Hemorrhage is the next term. Hemo means blood. Rage means excessive flow or discharge, and the term is defined as a loss of large amount of blood, and so that's pretty easy to understand. So I'm going to move on. Pancytopenia. Pan is not highlighted here, but that is my suffix, and pan means all. Cyto means cell, and penia means condition of deficiency. Pancytopenia is a decreased number of all types of blood cells. And the definition in the text also says due to a failure of the bone marrow to produce stem cells, and I don't think I need to know that, but I put it in here because it might help me remember that it is a decrease of all types of blood cells. And that can be a little bit tricky, and you probably will see that on exam. And you need to pay close attention to the word, this prefix pan. Septicemia. Septo means infection, emia means condition of the blood, and the definition in the text is severe bacterial infection of the tissues that spread to the blood. And it helped me to also know that this is also known as sepsis or blood poisoning. So I've looked up the pronunciation, the suffix, the word breakdowns of the four terms in blood conditions, and I've come up with simple working definitions that I think are very understandable. Looking at them again, I would say dyscrasia is any disease or condition involving blood cells. Hemorrhage is the loss of a large amount of blood. Pancytopenia is the decreased number of all types of blood cells. And septicemia is severe bacterial infection of the tissues that spreads to the blood. So once I have those mastered, I would be ready to go on to the next section. Again, it would help to have somebody to quiz with at this point, but if I don't have it, I just cover up the terms, make sure that I master the one section, and then go on to the next.